All right, and this is the ankle and lower leg palpations.
Fibular head.
It's over here.
Common peroneal nerve.
It runs down here.
Peroneus longus.
That goes in here to the bottom.
Peroneus brevis.
To the base of the fifth metatarsal right here.
Fibular shaft.
That's all this bone.
Lateral malleolus.
Boop.
Peroneal tubercle.
That's down here.
Calcaneofibular ligament.
That one's right here.
Anterior talofibular ligament.
That's in the sinus tarsi right here. Yeet.
Posterior talofibular ligament.
And that one's in the back right here.
Anterior tibiofibular ligament.
That one goes right across here.
Posterior tibiofibular ligament.
Goes back this way.
Peroneus tertius.
That one comes back here. Boot.
Tibial tuberosity.
That's down here, right here. Yeet.
Gerdy's tubercle.
It's right next to it over here.
Anterior tibial shaft.
Boop.
Anterior tibialis.
That comes right here. Yeet.
Extensor hallucis longus.
That comes down here and goes to the big toe.
Extensor digitorum longus.
Comes this way and to the little toes.
Extensor racanaculum.
That comes across right here.
Dome of Talus.
Boop.
Sinus tarsi.
That's over here. Doot.
Medial malleolus.
Doot.
Deltoid ligament.
All right here.
Sustentaculum tali.
It's right in here. Little shelf guy.
Tibialis posterior.
To the navicular. Yeet.
Flexor digitorum longus.
So this way to the little toes.
Flexor hallucis longus.
To the big toe.
Gastrosoleus complex.
It's all this right here.
Achilles tendon.
Right here. Yeet.
Subcutaneous calcaneal bursa.
And that's the one that's right underneath.
Subtendinous calcaneus bursa.
And that's the one that's like right under the tendon. Yeet.
And the calcaneus.
Boop. Alright, so now we're going to do active range of motion. And so I'll have her go into dorsiflexion. Can you go point your toes down, plantar flexion, and then we'll get this nice goniometer out. This way. Put this on the joint, put the stationary arm towards the knee. And I'll have her bring her toes up. Alright. And then you'll want that to be at 20 degrees. And then I'll have her do plantar flexion, so we'll put it in the same spot. And then I'll have her point her toes down. Alright. And you would want that to be at 50 degrees. And then I'd have her point her toes in that way and have them come out that way. Just holding this down to make sure she doesn't rotate anything up there. And so you'll put this way. I'm gonna put this on the joint right there, and then I'd have her point that way, then I'd move this way, and you'd want that to be at 20 degrees, and then I'd put it back over here, and then I'd have her evert, and then that should be about 5 degrees. And then I'll do passive range of motion, so bring the foot up, bring the foot down, side, side. Oh boy, we'll pop. And then manual muscle test, so I'll put my hand here and I'll have her push up. Nice. Push down. Yes. Push to the side. Yeet. Push to the outside. Nice. 10 out of 10. And so for the first test, we'll do the anterior drawer. So you'll just pull like this. And if that's positive, then that means there's laxity in the ATFL over here, and that could be a possible tear. So that's not good. And then talar tilt, you get this, and you hold this, and then you just tilt it to this side. Then you can do that side. If you're tilting this way, you're testing for that calcaneofibular ligament over here, and that's for laxity, and that could mean that that's torn. And then if you twist this way, you're testing for that deltoid ligament right here, and that could be torn as well, so you could have sprained that or hurt it really bad. And then the Kleigers is where you hold up here, and then you're gonna externally rotate. You're gonna evert and externally rotate. And if that hurts, then that can mean syndesmosis damage. So you could have a high ankle sprain, and then Pott's compression down this way, and that could indicate a fracture. If it's higher up, that could indicate a fracture. And then if it's lower on the leg, like where we did the syndesmosis high sprain test, the Kleigers test, it's down here, that could mean it's just a high ankle sprain. So watch out for that. And then a percussion bump test, you're gonna bump, bump, bump. And if they feel that and that hurts and they don't like it, that could be a stress fracture up in here. And then the Thompson test, deep lip. Oh boy. Oh boy. That's when you're gonna squeeze this. And her little footy is coming up, so that's good. That means her Achilles is not ruptured. But if it were positive, that would mean it is ruptured. And then next, she would come down off the table. And so this is the Homan's test. This is testing for deep vein thrombosis. And so if it's positive, she'll have pain when I dorsiflex her foot and then extend her knee. That would be really painful. And then if there's like redness and stuff in the back, obviously something is not right, so you should be aware of that. And so, yes. So the dermatome testing, so you have, I'll just hold this. You have the L1 that comes this way across patella to the big one, to the big toe, and that is dorsiflexion. Yay. And then L5 comes about this way to the web space right here, and that's great toe extension. Extend that great toe. Then S1 comes this way, and that one's ankle plantar flexion. Point down. Yes, those are all the myotomes for that. And then S2 comes to the back, and that one is knee flexion. And then when you're testing any of these tests, all the range of motion stuff, all the ligamentous testing, and all this dermatome, myotome stuff, you got to check on both sides. So I forgot to say that, but it's bilateral, just to let you know. And then, yeah, so there's all that. And then you would just test sharp and dull on all these points to see the dermatome stuff. So now we'll do reflex testing. So this will test for L1, L2, or L4 and L5. Oh goodness. Yay. I went a little bit there. And then you could do the Achilles too. Right here. Yeet. And that's the end of that. Except it's not the end of that, because I forgot the pulses. So there's the one back here, the posterior tibialis pulse. You can check for that right there. I feel it. Good beating heart, strong. And then you have the pulse up in here, the dorsal pedis pulse. Where you at, boy? There you be, right there. That's the end.